think we're here for the vaccine.
I'm here for a vaccine.
Really hoping to get it today.
There's growing frustration in the Fraser Health region surrounding pop-up vaccination clinics. Hundreds of people arrived here at Bear Creek Park in Surrey before dawn Thursday morning, hoping to get a shot. But they were left sorely disappointed. The future of these pop-ups just ahead.
BC's vaccine supply getting a booster shot next week.
Over 1 million doses of the Pfizer vaccine. And that means that our age-based program will be accelerated.
Priority group shots also speeding up.
While our provincial government, has not put in much support for safe supply, we're going to continue seeing levels of death like this. And it's devastating.
5 years into BC's overdose crisis, advocates are losing hope in the provincial government. Just ahead, March's overdose numbers and the ongoing calls for a more accessible, safe supply of drugs.
There are 853 new cases of COVID-19 in BC tonight. One more person has died in the last day. 503 people are currently in hospital, with 178 in the ICU. More than 1.7 million doses of the vaccine have now been administered so far in BC.
Starting next week as well, we expect to receive the Johnson & Johnson or Janssen vaccine, which is a single-dose viral vector vaccine. And as I've mentioned, we'll be integrating this into our immunization program. And currently, we are finalizing the plans for that, and we'll share that information with you early next week.
The province's age-based vaccination program is currently allowing people 58 and older to book an appointment. Health officials expect the program will kick into high gear next week, with more vaccine shipments expected to arrive.
We're here since 5 o'clock.
Came today at 4:45.
Since 4 o'clock.
It's been 3 days of confusion, long lineups, and misinformation at Fraser Health's pop-up clinics. Hundreds of people flocked to a rumored clinic here at Bear Creek Park Thursday morning, only to find out the pop-ups have been canceled.
Today we had no idea what we were going to do, where we were lining up.
People scrambled to line up at Bear Creek Park and Newton Athletic Park Thursday, hoping to secure a spot at another pop-up vaccination clinic in the Fraser Health region. The news was spread through word of mouth, but nothing was planned at either location. So people who were waiting in the parks for hours were met with police telling them it wasn't happening and they should head home.
At this point, we might have to wait for our own appointments, because I did take the day off work in the hopes that I would get my vaccine, and I didn't. So
That's why we made arrangements to schedule and made sure we are here this morning.
In time
We
for
were
the
here
party.
for vaccine, but now we are here for picnic.
Dr. Victoria Lee is president and CEO of the Fraser Health region. She's apologizing for the confusion and says there are currently no plans to offer any more pop-up clinics. She says the reason for the pop-ups was to boost vaccination registration in the Fraser Health region.
And this was kind of a boost to get that registration and booking and immunization faster, given the specific context of the fact that these are in the high transmission communities.
BC Provincial Health Officer Dr. Bonnie Henry also apologized for the miscommunication that led to thousands of people scrambling to get a spot at the pop-up clinics over the past few days.
There were some operational things that were done or not done that caused a lot of frustration, and I can see that, and I absolutely apologize to people for the miscommunications and for the confusion.
Another goal of this week's pop-up clinics was to immunize people in COVID hot zones, but the clinics in Coquitlam and Surrey reportedly drew people from other regions who were still able to get their shot.
If you don't live in Newton, don't go to the clinic in Newton. It's designed for that community. We look at our cases by where people live.
Burnaby physician Dr. Baldev Sangera says the intentions behind the pop-ups were good, but the execution just wasn't good enough.
We need to make sure that the people that require to be vaccinated are the ones coming to these clinics, and also that they get enough notice so they can take time off from work to come there.
Ultimately, those who tried and failed to get the vaccine at a potential pop-up say they're feeling left behind.
it doesn't feel all that fair that yesterday we learned about it, and because of what happened yesterday and the unorganized structure of it all, that it's now created a mess for all the pop-ups that were supposed to happen.
In Surrey, Ashley Burr, City News.
I can't say how Major General Fortin feels, but I think this is great news.
Some provinces prepare to start mass vaccination as vaccine shipments to Canada continue to ramp up.
BC's vaccination program getting a booster shot with a surge of vaccine supply in coming weeks.
We expect to receive over 1 million doses of the Pfizer vaccine, and that means that our age-based program will be accelerated.
Instead of another birth year called every few days or week, it could be every day. With patients faltering and panic setting in for some, it's the news many need.
Your turn will come, and I think we all need to just take a deep breath and know that there is vaccine for us, and it will be coming, and we will get it.
And with 15% of supply for priority groups, all police, fire, school staff, and childcare workers will be getting their first doses by mid-May.
Because 15% means a much higher volume of vaccine that we'll be able to provide people in the coming weeks.
Some of those one-and-done Johnson & Johnson vaccines also coming to BC, likely set aside for other frontline, more at-risk workers like truckers. But most are depending on the age-based backbone of BC's vaccinations. And it can sometimes seem like hotspots and priority groups are getting all that we have, but they're not.
More than 83% of people immunized, over 70. Only 4 local health areas in the entire province, under 30%. And so the variation between health authorities is not that great, which means everyone is getting access everywhere.
Supply has been the challenge, and not wanting to book ahead and then have to cancel clinics.
It has been a balancing act of vaccine coming in, and we've been down to less than 10,000 doses in the entire province on a Monday afternoon.
That trickle of supply will soon be a steady stream.
But it is taking longer than we would like, where we have clinics that are ramped up and ready to go as we're receiving more and more vaccine in the coming weeks.
Now, Henry imploring people to register online if you aren't, help others who need it, not just for now, but for second doses that are coming soon.
We need to celebrate for every single person who's immunized, because all of us collectively will get there in the next few weeks.
For City News in Victoria, I'm News 1130's Lisa Yuzda.
You could call it a case of good vibes between neighbors. One local eatery says they were starting to feel nervous after the city turned them down for an outdoor patio, but now says they're grateful after the business next door stepped in to help. A 19-year-old is shaken after a bizarre incident earlier this week. At about 1 o'clock on Sunday morning, police say that she was awakened to find a man in her bedroom who grabbed her by the wrist. This happened at an apartment building in Howe and Drake Streets in the downtown core. Police are not sure how he got into the building and say her suite was not on the ground floor. The suspect is 20 years old and has a history with police. Mental health may have been a factor. Time is running out for campers to leave Vancouver's Strathcona Park. The encampment has been set up for more than a year, and residents have to clear out by tomorrow morning at 10 o'clock. Police and neighbors have complained about crime connected to the park, and the Vancouver Fire Department has voiced concerns about dangerous conditions. BC's housing minister says campers can either choose to accept the housing they're offered or leave the park by tomorrow's deadline. More than 200 people have been moved to indoor housing from the park.
It's scary to think that it can get that much worse, but it absolutely can.
With BC already on track to break another annual record for overdose deaths, advocates are calling on the provincial government to step up before the numbers get even worse.
While our provincial government, has not put in much support for safe supply, we're going to continue seeing levels of death like this, and it's devastating.
The BC Coroner Service reports nearly 500 people in the province lost their lives to toxic illicit drugs in the first 3 months of 2021. Last month alone, 158 suspected overdose deaths were recorded. That's a 41% jump from March of last year.
The restrictions and the shutdown of some services, these are big contributing factors.
A year after the province announced new guidelines for prescribing safe drugs, Jordan Westfall with the Canadian Association for Safe Supply says provincial initiatives to address the overdose crisis just aren't enough.
It's been devastatingly slow. It's been, we were first promised an expansion to the dual risk mitigation guidelines in August 2020. And we're going on 8 months now later. And we just saw the BC budget come out, and no money allocated for safe supply.
In response to March's overdose numbers, Minister of Mental Health and Addiction, Sheila Malcolmson, says the government is ramping up treatment and recovery services, adding new treatment beds and trailblazing solutions like prescribed safe supply and nurse prescribing. The federal government has committed $15 million over 4 years to support safer supply projects in BC.
And each project will support about 50 to 100 people. So, that's 300 or 400 people that have a safe supply. But that means there's about 82 to 83,000 people who struggle with opioid dependence alone in BC who won't get access. So it's a drop in the bucket, unfortunately.
The highest number of drug toxicity deaths this year are in Vancouver, Surrey, and Victoria. RCMP in Surrey say there have been 6 of them in this past week alone.
We're urging people who do use drugs in the community to please exercise caution at this time, and we strongly urge people not to use drugs alone.
It's a message that Westfall is also reminding people of as the COVID-19 pandemic carries on alongside the overdose crisis.
What's best public health practices for the rest of BC for people who aren't at risk of overdose is the opposite for us.
Miranda Fatour, City News.
I could see that not having a patio was really hurting my neighbors, so I thought I'd offer them the space.
Neighbors are willing to help each other out, and I hadn't thought to ask.
One local eatery in Vancouver's Mount Pleasant neighborhood says they're feeling particularly grateful after the business next door stepped in to help when the city couldn't. Heather runs the Wallflower Diner with her husband. This week she took to Twitter to shout out her neighbor, Pulp Fiction Books, for allowing her to use their storefront for more outdoor seating after the Wallflower was turned down by the city for a street-side patio. When your neighbor approached you guys with that idea, how did you feel?
Very surprised and happy, and it was something that hadn't even occurred to me that was something we could do. I just hadn't thought about it, and I also thought, well, there's no way the city will let us do that, but they did. So yeah, surprised, but really excited about that. And heartwarming, of course.
Just scrubbing it.
Chris, the owner of Pulp Fiction Books, says a lot of businesses on Main Street have been able to get a patio, and he was surprised when the city declined the Wallflower without explanation or context, at least until this week. Construction equipment rolled in and got to work reducing traffic to just one lane for the next couple of months, suddenly making the reason for the city's decision very clear.
So I was thinking, well, we have an awning. We have a little bit of space that's, out of the rain that's not city property, that's actual private property. Normally my recycling buckets sit on it, not much else.
And he saw an opportunity to help a neighbor out. His offer effectively tripling the outdoor dining capacity for the Wallflower from just 1 table to 3.
I think everyone who does not run a food service business has no idea how hard it is right now for folks who are running food service businesses.
Do you notice anybody, getting a book in here, then going next door, getting a coffee, and then going out for a seat?
It's been happening for as long as we've been neighbor businesses. There's a very nice flow.
Yeah, it makes me feel good. It's good to see businesses support other businesses.
It was really nice to see that something was done.
At the same time, Heather says she's hearing a lot of stories about businesses looking out for one another.
Every time I see one restaurant who is having a hard time, I do see other restaurants helping promote them. So if anyone's struggling out there with something, then just, speak up, and maybe someone out there will be able to help you.
In Vancouver, David Zura, City News.
I can't say how Major General Fortin feels, but I think this is great news. We've been waiting months now for this news.
Federal public health officials say they're happy to see some provinces start to release timelines for vaccinating all adults, but remind us not to let up on public health measures. Meanwhile, the man in charge of vaccine logistics says this is all possible due to a big ramp up of vaccine shipments to Canada.
If you look at what we have received to date and distributed, which is approximately 15 million doses, since we started in December. What you will see between now and the first week of June is about the same amount.
Major General Fortin says he's expecting Moderna to start arriving again with a shipment of 1 million doses the week of May 10th. Fortin says Moderna delays were due to quality assurance issues and adjustments to the shipping schedule.
They assure us now that they're coming out of this strong. They've increased their production. They're aiming to provide as many doses as possible, up to the 12.3 that they had committed to for this quarter. And over the next 9 weeks, this would mean, if you even it out, about 1 million a week.
Meanwhile, the first shipment of 300,000 Johnson & Johnson single-shot vaccines arrived in Canada Wednesday night and are on their way to the provinces. Public Health says NACI is looking at that vaccine's data now and will likely have a recommendation soon.
After that, it's really up to the provinces and territories to decide, based on the NACI's recommendations, to decide where to how to integrate these vaccines into their immunization program.
Now, Health Canada says some low-platelet blood clots seen in the U.S. may be linked to the J&J vaccine, but says the benefits still outweigh any risks. A decision the regulator says is in line with what the U.S. and EU have decided. In Ottawa, Xiaoli Li, City News.
Just before we say goodnight, a quick update on the Canucks game. Vancouver is taking on the Toronto Maple Leafs, and the Canucks trail 3-1 late in the third period. We'll have all the highlights on your next edition of City News, which is tonight. Thanks for watching and have a great night.